Hello, we are going to be talking about muscular dystrophy, and we are the Brooke squared. So a little bit of history to start off. As you can see in this timeline, there are a ton of individuals that claimed that they were the first to describe muscular dystrophy. But what I'd like you to all take away from this timeline is that in 1836, Conte and Gioja described two brothers with progressive muscle weakness. Then in 1852, Dr. Edward Meeran described a family with 4 boys, all affected by significant muscle changes. Now, this is really interesting because he suspected that the disorder was genetically transmitted through females and affects only males. Later, you will find out that a type of muscular dystrophy, Duchenne muscular dystrophy, is very common in males, so he's kind of ahead of his time. Then, Guillaume Benjamin Amand Duchenne, he had an account of muscular dystrophy. He recorded an account of muscular dystrophy in 1961, and he was very famous with the application of Faradism, which is the use of electric currents to stimulate muscles and nerves to treat neurological disorders. Now, he was very famous, so Duchenne muscular dystrophy was named after him. Now, there are at least nine types of muscular dystrophy, but we are going to focus on 3 main types, which is Duchenne muscular dystrophy, Becker muscular dystrophy, and facioscapulohumeral muscular dystrophy. Muscular dystrophy is a group of inherited progressive muscle disorders that differ according to which muscles are affected. Now, all types result in deterioration of muscle strength, power, and endurance, and the rate of progression or progressive degeneration is different for each set of muscles. Again, I said that we're going to focus on 3 main types, and I kind of think of these as the 3 divisions of the NCAA. So Duchenne muscular dystrophy would be Division 1. It's, mostly in the news, gets a lot of attention. And Duchenne muscular dystrophy is the most common form in children. It is the most rapidly progressive form. And as I mentioned before, it is most common in boys. It actually occurs 1 in every 4,700 male births worldwide. Now that seems kind of rare, but it is, again, common to boys. It is an X-linked recessive disorder, and usually it presents itself between ages 2 to 3. It affects the pelvic girdle first, as you can see in this image in the dark pink, followed by the shoulder girdle, also shown in dark pink in the image. And between ages 7 to 12, children with Duchenne muscular dystrophy normally need a wheelchair, and they're susceptible to respiratory infections and have weakened hearts. So their life expectancy is usually late teens or early 20s, which is kind of sad. However, due to research and new methods, they are able to live past their 30s recently. Now, there are indicating symptoms of Duchenne muscular dystrophy, including a waddling gait, as shown in the image, toe walking, also shown in another image, lordosis, another, visual on the side. It kind of causes the children's stomach to protrude outward. You can see in the visual. And then also they experience frequent falls and difficulty getting up after falling and difficulty climbing upstairs. And then Gower's sign occurs when this child tries to stand up, but uses their arms really to propel them upward instead of just being able to stand up like we can do on a daily basis. Now, Becker muscular dystrophy is kind of like Division 2. It's kind of like Division 1, but not really. It is similar to Duchenne muscular dystrophy. It's an X-linked disorder, but it's less severe than Duchenne is, and the Muscle weakness usually becomes apparent between ages 5 to 15 rather than younger ages like Duchenne. The advancement mimics the Duchenne type, but it progresses way more slowly. So wheelchair use is not normally needed until adulthood, and life expectancy is also increased to like 30s or 40s plus. Now, the third type of muscular dystrophy is facioscapulohumeral muscular dystrophy. Yes, I looked up how to pronounce that. It's kind of comparable to Division 3. It's not exactly like Division 1 and Division 2, but it's still very important to talk about. For facioscapulohumeral muscular dystrophy, the onset is early childhood, but it's more noticeable in teenage years. It affects both genders, and it first weakens the facial muscles and then the shoulder girdle, as you can see in the image. Muscle weakness and deterioration can lead to scoliosis and lordosis, as we mentioned earlier. And it's a very mild and slow progression, and children with this type of muscular dystrophy have a mask-like face, so expressionless. They have trouble drinking through a straw and raising their arms above their head. Their life expectancy, though, is normal, and they do not lose their ambulation, so they really don't need a wheelchair, which is nice, positive.
Now we're going to go into some of the characteristics of muscular dystrophy. Remember, these are very important to remember. So common characteristics of muscular dystrophy include progressive weakness produces adverse postural changes, deterioration in muscular strength, replacement of muscle tissue with connective tissue, individuals tire quickly, lack of motivation to learn because of isolation from social contacts, and emotional disturbance may be present because of the progressive nature of the illness. Now, there are no apparent central nervous system impairments with muscular dystrophy as well. So, a muscular dystrophy etiology. So, I personally did not know what etiology meant, so I had to look it up, and it is the cause, set of causes, or manner of causation of a disease or condition. So, as you can see in the picture, dystrophin is this yellow-like noodle structure that is in this image, and it is a gene mutation. It's necessary for normal muscle function, and there's more than one type of mutation that can occur. This is primarily in cardiac and skeletal muscles, and specifically for Duchenne, the mutation prevents production of dystrophin, which is a functional protein. So this causes deterioration in muscles due to lack of dystrophin protein and scar tissue development, as well as muscles contracting and relaxing when they shouldn't be, and this causes the rundown of the muscles as well. Now, many of you are probably thinking, why is this dominant in males? Well, this is a recessive X-linked disorder. So the error in the X-linked recessive gene occurs, therefore affecting more males. So we can see in this picture like how everything is passed on, how individuals are affected, unaffected, and who is the carrier. So males have one copy of the X chromosome from their mother and then one copy of the Y chromosome from their father. So if the X chromosome has the dystrophin mutation, then they will have the Duchenne muscular dystrophy. Now, females have two copies of the X chromosome, and if one does not work, the other chromosome can produce the dystrophin protein that is needed. A woman who has a genetic change in one of the two copies of the X chromosomes is considered a carrier then, and most carriers are unaware of actually carrying muscular dystrophy unless they have found this in their genetic material of their family history. Now, when looking at safety considerations to have in our physical education setting, we want to have a support or chair nearby because we talked about how these individuals tire very quickly and allowing rest when needed. Physical education is recommended for students with muscular dystrophy because of the way that it helps them strengthen their muscles a little bit more. And this includes looking at equipment needs that they may need. So in this picture here, we have different equipment needs for different individuals and safe equipment as well. Now, another kind of aspect that we looked at when looking at safety considerations was the possible medication uses of these individuals. So medication like prednisone, creatine, all these types of medication usually help improve muscle strength and also improving the working heart of the muscles. So we need to be aware of the possible side effects that may occur with those medications. And it's very important to have a variety of placement options when having these individuals in class as well.
There's some teaching tips for muscular dystrophy. So individually designed activity programs are really beneficial for these students with muscular dystrophy since they increase their quality of life. Resistance exercises are not recommended since they can accelerate scarring, and you want to really have low impact activities for children with muscular dystrophy. And these low impact activities should focus on training their remaining strengths in order to improve those, since they obviously cannot really move well with their other parts of their bodies. Aquatics can be very beneficial. In this image on the side, you can see a woman helping a young girl with muscular dystrophy swim, and that's actually taken from Living Unlimited Summer Camp, which is a camp that invites children with muscular dystrophy. So I thought it was kind of cool. Integrating stretching into activities is really important, and you should always emphasize pleasure in physical activity. It's really important to teach students with muscular dystrophy skills that they'll be able to use throughout the rest of their life, like fishing and bocce ball, and these are more of leisure and recreation skills. What's also important is to teach relaxation techniques. These can really help students kind of release some of the stress that they may be feeling since they do have shortened lifespans, and that's obviously not a positive thing to think about. Equally important is integrating dance and music into activities, because this can also help students with their emotions and releasing that stress. On this top photo, you can see a teacher with a student. You can't see their faces, but there's a student in a wheelchair that has muscular dystrophy. I've actually watched the video of this activity, and she is just tossing beanbags to polyspots. She doesn't have any mobility in her lower limbs, but she had very slight mobility in her upper limbs. So as you can see, the polyspots are pretty close to her, so she's able to gain that success, which is nice. And she smiles in the video, which is sweet.
So now on to some interesting facts. So we found that muscular dystrophy affects the throat, heart, lung, stomach, intestine, and spine. So it's not just our muscles per se. And muscular dystrophy can first show signs as late as 70 years of age, which we thought to be very lengthy in time. And it's important to remember it is not as limiting as most may think, and it can be very painful. So this may have an impact on their mental health of the individual, so causing more stress and having more conscious thoughts. So those are just some interesting facts that are found with muscular dystrophy. Now this next page, you can pause here and kind of look at what we're going to do in class for active learning. But that is all we have, so thank you.
Thank you.